Thank you.
Many of the health pundits of Western countries who are into sports, who are into like diet management and all, because now the blood sugar level can be monitored with different apps and all, so it has become kind of a craze for cutting down on the foods that increase the blood sugar level. Which causes a sudden spike in the blood sugar level. So it has literally gone out of control. So I was listening to one of the there's a podcast by Rhonda Patrick. She's a PhD, and she said that she watches. After taking every different types of foods, she measures her blood sugar level, whether it's spiking and all, and she found out that she is healthy, non-diabetic and whatnot, but she found out that grapefruits cause an immense spike in the blood sugar level. So she was indicating to avoid grapes. But this, sugar level, whether it is spiking or not, by avoiding that, she's avoiding also the nutritious and other phytonutrients which are gifted to us by grapes. So sugar control is not like in the only criteria to be concentrated upon, sir.
No, it's a important point that we need to cut down on the carbohydrate, but not to such a level that you are going to hamper are we going creating a deprived condition for carbohydrate. That is not the extreme ends of the situation. That is not the right kind of thing. Wherever, see, for example, if a patient is having blood sugar levels around 270 after food, then some medication has to be brought in. Then try to reduce the carbohydrates by 20%. Like if he is consuming 2 cups of rice, ask him to go for 1.5 cup or 1 cup, something like that. You need to reduce by step, and then you come to a place where you can fix the dosage of that particular person. So it is from person to person, it varies, and it is an individual customized method. You can go ahead with this, and ultimately fixing a person's diet basically not only depends on the type of food, but also its agni. See, if my agni is not proper, if I ingest lot of material, it won't get digested and goes out of the body, then it won't increase the sugar. If it is to be digested, then it is assimilated, then it will go into the bloodstream. So Agni is also having important role. Then there is a absorption. It is to be done by some receptors. Some dhatu materials are required to convert it into our body tissues. So all these are what you call Bhautika Agni. All these type of hormones or enzymes. These are all liquid. Everybody has to play their role. Simply cutting down on the carbohydrates or even totally avoiding carbs, that is not going to help anyway. Sometime later, then the patient may end up in some tissue damages and wear and tear. I have seen patients using Siridhanya continuously. After a few months of using Siridhanya, they come out with pain in the joints, even though sugar levels are normal. Clearly, Siridhanyas are very ruksha in nature, and definitely it will going to increase vata in the body. So once vata is increased, definitely it also leads to pain. We need to be very careful in handling these things. It's simply reducing the diet for some time is a very ideal way. Work up comparatively more work up than what we are doing it, and it has to be designed according to the person's need. We need to take a lot of history while collecting from the patient about his personal habits and the way of doing vyama exercises and all those things. What is the quantum nature of work he is doing? Based on that, we can give some suggestion and variation or how to increase by step. It doesn't mean that simply for a person one who is already doing 1 hour of practical exercises and all those things, you ask him to go do it for 2 hours or 3 hours, then they may end up in suddenly some cardiac arrest and some problems will be there. Recently, we have a very strong personality at the very early ages like Siddharth Shukla. He died because of cardiac arrest, maybe because of excessive work. We don't want to do all those things. Simply step by step increase the condition demands accordingly, fix up the dosage of medicine and also reduce the sugar intake, then fix the dosage of medicine and even the exercises, quantum and everything, then definitely that will be a very good choice.
And also recently, a couple of years before, even the Westerners also, they revised the blood sugar level controls, and they said that very strict management of like, I mean, especially in an already established diabetic patient, it's not like hard and fast rule that the fasting level should be below 100, and you know even if it is in the range and if it is maintaining well, that is quite sufficient. Rather than we should not be like pulling down the blood sugar level too much, sir.
See, I'll tell you one thing. We have pipes in our houses and they are heat sensitive. I correlate here heat to glucose. If the heat in the running water increases to 150, the pipes will melt. Okay. So do you think that if the heat in the pipe, if it is increased during the daytime at early morning, then it won't cause any problem? If it happens in the afternoon, then it is a problem. How can it be? When temperature reaches beyond certain, that pipe will definitely melt. Here also, if blood sugar reaches beyond a certain level, definitely it is going to cause a damage in the internal organs. So whether you are in a fasting condition or you are in a postprandial condition, and it's a random blood sugar, it is expected to be within the range. It doesn't mean that it should be somewhere, always it should be, fasting sugar should be somewhere between 120. If it is just 130 or 140, then it is going to cause damage. No, though there is no such hard and fast rule. And of course, person to person, from continent to continent, and even the race difference is also there. We cannot simply fix for everybody one type of blood sugar levels. We cannot fix it as a normal. The normalcy can vary with a you can say that as a normal variant. There are many variations across the globe that should be kept in mind. Simply, we cannot something line as 150 is the ideal one. You always keep it below 150. No, we need to understand that what is his body mass, what is his weight, and what is his nature, and what is his race, what is his consuming, what is his problem. Everything you just go by step, then analyze accordingly, then slowly shift it back to bring it to the normalcy. Or otherwise, simply pulling down everybody to come under 150, that may not be a right kind of thing, because we have people with 45 kgs weight, we have people with 100 kgs of weight, and nobody will not be having the same type of blood sugar levels. So we need to understand that there are a lot of issues to know about.
You conveyed is, let's not too much dwell into the laboratory reports, see the person in front of you and judge, rather than taking too much of laboratory reports.